Hi everyone, I'm Dr. Undavia, and today I wanted to show you the best way to medically treat septal perforations. So first of all, septal perforations are holes in the nasal septum and are pretty distressing to patients because they can cause excessive crusting, excessive antibiotic use because of excessive infections, nosebleeds, pains, and external nasal deformities. So when we first identify septal perforations, it's important to have the right medical provider evaluate it. And that's an otolaryngologist, head and neck surgeon. And that's because we need to find out why it happened. Now, once we know why it happened, if anything medically needs to be done, it can be done at that time. Then, the most important aspect of treatment is really hydration. And that includes a sinus rinse, which is a saltwater solution that can help to irrigate away nasal mucosal crusting and hydrate the nasal mucosa. Periodic use of nasal saline every few hours can also be very helpful while you're awake to keep the nasal mucosa wet. And finally, Vaseline can help the nasal mucosa have a thick layer of protection, so it prevents the edges of the perforation from becoming raw, which can be really helpful to prevent crusting and bleeding. Now, when it comes to controlling bleeding, a very conservative approach is needed because excessive cauterization to that area can make the perforation much larger. So it's better to control bleeding with gentle pressure or topical hemostatic agents instead of controlling it with large pressure dressings or excessive cauterization. Of course, if a large bleed is happening, then you need to control the bleeding. So if it requires a large pack, then it requires a large pack. At times, if patients aren't surgical candidates, a septal button can also be used. Now, this is a plastic circular small device that can be placed between the edges of the perforation, and it can be done in the office. And that's used to help prevent bleeding, crusting, and nasal obstruction. Now, once it's placed, it needs to be routinely cleaned and exchanged once in a while just to keep it nice and fresh. So I hope this helps you understand what's medically needed for septal perforation treatment. If you have any questions about septal perforation repair or have a perforation that you want evaluated, email me directly at info@drundavia.com. And since not all perforations can be closed, and since a lot of my patients come from outside of the state of New Jersey, it's helpful to have medical records, endoscopic images, and any other information that you think is important emailed directly to me, so that if there's anything that needs to be done prior to you making the trip out here, we can take care of that so you can save some time and hassle. So thanks for tuning in. Remember, trust your face to a specialist, and until next time, I'm Dr. Undavia.